Joint mobilization is a manual therapy intervention, a type of passive movement of a skeletal joint. It is usually aimed at a target synovial joint with the aim of achieving a therapeutic effect. The main goal of joint mobilization techniques is to increase range of motion. The purpose for glenohumeral anterior glides is to increase shoulder external rotation and extension. Have the patient lay prone and position the humerus over the side of the table and forward about 30 degrees. Place a towel underneath the athlete's glenohumeral joint. Then the clinician will position his or her hip underneath the athlete's axillary region. Apply traction by pushing the humerus down using both hands. Do not arc the athlete's humerus upward by lifting his or her elbow. Be careful to not hyperextend the shoulder as it causes anterior dislocation of the shoulder. Next, we have the elbow humeral ulnar distraction. The purpose is to increase elbow joint mobility in flexion or extension. Get the athlete to lay supine on the bed. Place his or her arm at about 70 degrees of elbow flexion. Rest the athlete's arm onto the clinician's shoulder for stability, and place both hands onto the proximal ulna and apply a distal force, almost like a scooping action. Finally, for the tibiofemoral posterior glide, the goal of this joint mob is to increase knee flexion. Position the athlete supine on the bed with their knee flexed at about 90 degrees and their hip flexed at around 40 degrees. Place both hands on the proximal tibia right below the joint line and make sure the hamstrings are relaxed. Apply a posterior force onto the proximal tibia to create a glide motion in the tibiofemoral joint. Next, we'll have distraction of the subtalar joint. The goal is to distract the calcaneus from the talus and to increase accessory motion into the subtalar joint. Have the athlete lie in a supine position and place a towel underneath the Achilles tendon while the ankle is in a neutral position. Place one hand around the fibula and tibia distal malleoli to create leverage and stability. Hold on to the calcaneus with the other hand and create a distal force, distracting the calcaneus from the talus. PNF stretching, or proprioceptive neuromuscular facilitation stretching, is a set of stretching techniques commonly used in clinical environments to enhance both active and passive range of motion in order to improve motor performance and aid rehab. For this PNF stretch, we will be working the lateral scapula. Have the athlete sit up on the bed with their knees hanging off at 90 degrees. Have the athlete grab the back of the table with both hands to add stability. Next, the clinician will place one hand on the right shoulder and the other hand on the back of the head and rotate the head towards the athlete's left shoulder and will apply an anterior force. Make sure the athlete fixates their eyes towards the right knee in order to create a deeper stretch in the lateral scapula. They will hold this for 10 seconds. After, the clinician will create a resistance towards the head, and the athlete will push their heads to add resistance to the clinician's resistance. They will hold this for 6 seconds. And after this, they will finally add another stretch, and they will hold that for 10 more seconds. Next, we have external and internal rotation of the subscapular. Have the athlete lie supine with their shoulder hanging off the side of the bed, and place the elbow in a 90-degree angle as you assist the athlete into external and internal rotation. Hold each stretch for 10 seconds, and then the clinician will then create resistance while the athlete pushes against it. Hold this position for 6 seconds. Finally, assist the athlete in external and internal rotation and hold it for 10 more seconds.
Good. This is always pretty tight.
Here we have the passive hamstring stretch. Have the athlete lie in a supine position with both their legs extended. While making sure the leg is fully extended and not bent, guide their leg up towards the ceiling while their ankle is in a neutral position. Ask the patient when they start to feel the stretch, then stop and hold for 10 seconds. Make sure their opposite leg does not lift off of the table and have the athlete's toes point towards their belly button. Next, the clinician will add resistance while the athlete pushes against it, creating a contraction in the hamstring. Hold this position for 6 seconds. Finally, have the athlete's hamstring relaxed and apply one more assisted stretch and hold for 10 more seconds. Last but not least, we will be doing a prone passive quadricep stretch. Have the athlete lie in a prone position on the bed and raise the athlete's quadriceps off the table and bend the leg by pushing their ankle towards their buttocks. Hold this stretch for 10 seconds. Next, the clinician will have the athlete resist against his or her resistance on the distal aspect of the leg. You will now hold this for 6 seconds. Finally, the clinician will assist the athlete again in a passive quadricep stretch and will hold for 10 more seconds.